Thank you for the invitation to present my study. We know that there is a strong correlation between postprandial hyperglycemia, hemoglobin A1C, and cardiovascular risk. Because of this, meal timing and composition should focus on reduction of postprandial hyperglycemia. We know that postprandial hyperglycemia and all glucose metabolism is controlled by our body clock. The circadian clock, the master clock, is in the suprachiasmatic nucleus, and there most of the genes in this nucleus are responsive to the light. Similar clocks are all around our body, most of the tissues like liver, beta cells, the muscles, and the adipose tissue producing glucose, ghrelin, insulin, GLP-1 in the circadian manner, and these genes are not responsive to the light, they are rather responsive to the meal timing and meal composition. It starts on sunrise. When we wake up, the breakfast consumption by stimulation, insulin, and I'm sorry, wow, what happened? How to go back? There. And this is the pointer. Okay, so breakfast consumption by stimulation, insulin, GLP-1, ghrelin suppression, and other signals activate the circadian clock's machinery. The clock and BMI dimerize and mediate the transcription of period and cryptochrome genes, and this activates the synthesis of period and cry protein. These proteins associate and go to the cytoplasm like CP units. The CP units accumulate in the cytoplasm, and after 24 hours they go back into the clock and stop the clocks until the next breakfast and next sunrise. The same machinery stimulates the circadian rhythm of PPAR gamma genes that are involved in beta cell secretion of insulin, in circadian rhythms of GLP-1 and muscular glucose uptake, and also the reverb alpha genes that are involved in glucogenesis and hepatic glucose production. In addition, the MPK modulate most of the clock genes, and MPK is mostly involved in the GLUT4, muscular glucose uptake, and beta cell viability and insulin sensitivity. Okay, so after all, the clock stops, and again in the next day, the breakfast activates all this machinery again. Our hypothesis is that the breakfast consumption, through the activation of the clock machinery, increase the GLP-1 signal, the GLUT4, and the insulin, and by this mechanism, reduce the postprandial glycemia. We base this hypothesis on previous studies showing that a diet with big breakfast and small dinner as consequence a reduction of overall postprandial glycemia, in contrast to the vice versa schedule with big dinner and small breakfast. Also, we showed previously that the increase of glucose after lunch and dinner is significantly higher in the participants when they didn't eat breakfast compared to the participants when they eat breakfast. So now we conducted the study to evaluate the clock gene in 2 days, in healthy and diabetic patients in 2 days. 1 day with breakfast and lunch, and the other day without breakfast, only lunch. And we found that you can see in green, whatever happens in the morning before breakfast and before lunch, whatever happens on the day that the people ate breakfast, all the clocks were upregulated after lunch, both in diabetic and in healthy. To better understand it, we can see that in green, this is the day they eat breakfast, the MPK, the BMI, the PER1, and ROR alpha genes were upregulated after lunch on the day when they ate the breakfast. Instead, there was the same genes were downregulated when they didn't eat breakfast. It was associated, the green is when they eat breakfast, with significantly lower increase of glucose after lunch and significantly higher increase of insulin and GLP-1 after lunch on the day they ate breakfast. Similarly, in the health group, also the same genes were upregulated, and the glucose also was lower, or everything happens the same but in lower magnitude. So we showed that rapid change in clock gene MPK expression after lunch on yes breakfast day versus no breakfast day. We showed that the effect of the breakfast is acute, as only 1 day of skipping breakfast led to such a deleterious effect on clock gene MPK, glucose, insulin, and GLP-1. It is important to emphasize that the same clock genes that regulate the glucose also regulate the obesity, hyperlipidemia, diabetes, endothelial dysfunction, atherosclerosis, the renal dysfunction, the blood pressure. So it means that as it is deleterious for glucose metabolism, it can increase the risk of cardiovascular disease, diabetes, hypertension, and other complications. So at the end, long-term studies, I wanted to determine the effects of the different mealtime schedule of clock gene regulation, glucose metabolism, postprandial hyperglycemia, body weight, and heart and endothelial function. This is the team. Some of us, we are in the Tel Aviv, in the Watson Medical Center, the other in Hebrew University of Jerusalem, and Boaren from Sweden, and thank you very much.